following the Democratic debates at all, you know that the number one topic every time seems to be healthcare, and specifically Medicare for All, whether they support it or they don't support it. And so I think it's very important for not just for us to make our own decisions and to make up our minds on candidates, but to be able to talk to our neighbors, many of our neighbors who immediately think that it's the end of the world if this happens. But if we're going to talk and have a conversation with someone, we really have to educate ourselves and know the details and know the ins and outs of it and what it really means. So I am so happy because I've been communicating with Eli on email for about a year now, and I've never met him until tonight, so I'm delighted to do that. Eli is the president of Michigan for Singlepayer Healthcare. It's a 501c4 nonprofit that advocates for single-payer insurance. He's very knowledgeable on the topic, and I hope you have questions ready for him when he's ready to answer them. And let's give a big round of applause to Eli Rubin.
Thank you so much, Sherry. And Nancy, who's not here, for inviting me. It's really an honor to speak in front of this group. I have to say, there's a lot of Indivisible groups. There's a lot of them that sort of sprang up after Trump's election. But and I've spoken to a number of them and organized with a lot of them. And I can't think of another one that's as well organized and is going as strong. We're 3 years now down the road as Huron Valley Indivisible. I think you should give yourselves and your leadership a hand, because it's so hard to keep the momentum going. It really is. And so if you've made it this far, you've sort of made it over the hump. This is a presentation that's, some presentations are short and sweet, kind of get right to the point. This is not one of those. This presentation is going to get you into the weeds, as they say. Before we get started, just a brief bit about myself. I, in some ways, am involved with this because, unlike a lot of people, I haven't had a really terrible experience with healthcare in my own family. Instead, I had a really great experience, only it wasn't in this country. It was in Germany. I was living in Germany for work, and my wife, my then wife, who's now my ex-wife, but she had partial EU citizenship, so Ireland, but it's the same if you go to Germany. And we had a kid born there. And so we were on the German, the public, the national insurance, and it was an amazing experience. I mean, we had total freedom. We could go to any provider. We didn't have to find out who was in which network and who took what and what the co-pays would be, and nothing like that. My then wife wanted a very naturopathic childbirth, so she picked a midwife clinic, an old pre-war apartment building in Berlin, and where they only used acupuncture and aromatherapy. There was no... This turned out to not be a good idea. And I'm not even the one that had to go through it. The baby was fine and everything, and he's fine, but wouldn't do it again. But the point is that was her choice. That was what she wanted, and it was paid for. And we ended up paying like 30 euros at the end of it all. And the midwife came to our apartment every day for like a week or 10 days, and then every other day for a certain amount of time. It was all included. So I came back to this country, and it was just really a shock that we don't have that. And that's taken for granted in Germany, Australia, Israel, Iceland, and so on and so forth. So we're going to get started on this. I do want to just start with this as a reminder that in many ways, Martin Luther King is still so far ahead of his time, and if he had been allowed to live, he probably would have led us, to where we want to go a long time ago. And I'm reminded of that in so many ways, that he was very much aware of the broken healthcare system, health insurance system that we had 50 years ago. And his quote that injustice in healthcare is the most shocking and inhumane, he meant by that when you're talking about healthcare, you're talking about people's very lives. You're talking about their ability to live, their children's ability to live, their parents' ability to live. injustice anywhere is injustice everywhere, as he said, but injustice in healthcare costs you your life. It's that direct. And so for our organization, we're advocating for a very specific policy, but bigger than that, we're advocating for a vision of a country in which it doesn't matter how much money you have in your bank account. At that moment, you can get the health care that you need, all right? It's not, you don't have to, it's not based on how much money you have. So let's take a look at the problem, and we're going to get an idea of the scope of the problem, the dimensions of the problem in this country, and then we'll look at the solution. Okay, we spend far more per capita, okay, than any other industrialized country. I'll move around a little bit so I'm not blocking people's too much. We spend, so this is per capita, so, or this is actually a share of GDP, right? We spend more than twice what other countries spend. The only country that's close to us in terms of GDP is Switzerland, which probably has the system that's closest to us. And yet we rank far behind most other industrialized countries in terms of just about any criteria you want to look at. Life expectancy, we're way behind other countries. Infant mortality, we're way, way behind other countries. And in terms of maternal mortality, it's really bad. And if you isolate these factors for women of color, especially African American women, it doubles even beyond this, right? So we're not getting our money's worth. And you can combine this. So this is what's called a scatter chart, right? Where you're combining two factors. How much we spend on this axis, right? Versus how good our healthcare system is based on all those factors, our life expectancy, maternal mortality, infant mortality, so on and so forth, right? The worse you are in terms of your health outcomes is down here, the more you spend is down here. You see how much of an outlier we are. This is all the other countries, they're all industrialized, they're all modern. None of them are as rich as us, but they're all fairly rich. If you've been to Germany or Sweden or Canada or the Netherlands or New Zealand, you know, it's kind of like America with this one exception, right? So we're going to talk about single payer. There's different versions of it. Universal health care, though, is the thing that everyone else has but us. Universal meaning everybody's covered. One way or another, everybody's covered. There's different systems of doing that, but we are not just the only industrialized country that doesn't have universal health care. When you look at it, the red are the ones that really have like no guaranteed universal health care. We're in a group with Guyana, Iraq, Syria, Afghanistan, Pakistan, Indonesia, Angola, Chad, Somalia, Ethiopia. Actually, Ethiopia has, the blue is sort of like a hybrid system. Ethiopia has a better system than us, all right? So listen, so the ACA happened, right? It was a huge fight, we remember that. And it did a lot of good, but it didn't go far enough. And if you talk to the people who were around back then, who were part of that fight, they'll tell you it was never intended to be the end station. It was intended to be the halfway point that they could get to at that point, considering how many votes they had in the Senate. And so that's really where we're at. 30 million people are still uninsured in this country. 45,000 people a year in the U.S. die directly as a result of lacking insurance. And unfortunately, that number hasn't changed since before the ACA. That's one of the problems. And we'll talk a little bit more about why that is. But a bigger problem that the ACA, and this is why our organization advocates for going beyond the ACA, beyond Obamacare, building on it, going beyond it, is that this is a problem that Obamacare didn't really solve. There are a lot more people who have insurance in this country, but they are what's called underinsured, meaning they technically have insurance policies, but they can't afford to use them, right? They are covered, but that doesn't help them when they actually have to go to the doctor. And that's partially because of the issue of deductibles, right? And we all know this, deductibles are the amount that you have to kick in before your insurance kicks in. The average deductible has risen 212% since 2008. At $1,350, meaning you have to pay $1,350 before your insurance starts working, even though you're paying every month anyway. But many, many, many plans have much higher deductibles, $4,000, $5,000, $6,000, $10,000, which means if you get in a car accident and they've got to, stitch you up and set your leg and do the x-rays and the anesthesia, you're well over $10,000, you're waking up to a $10,000 bill, right? And that's a problem for a lot of Americans. 40% of Americans don't have $400 in their bank account to cover an unexpected expense. That could be a deductible that they have to cover. That could be the transmission breaks and they have no other way to get to work. 61% of Americans can't cover $1,000 in unexpected medical bills. So if the average deductible, is $1,350, that means that almost 2/3 of Americans, 3/5 of Americans can't meet their average deductible, right? So that's a big problem. But of course there's also premiums. That's the amount you have to pay each month before you even pay your deductible. And that's also gone up. And then you can see again in 2006, the premiums were $12,000, they're now $19,000, right? And the blue part is how much your employer pays on average. The dark blue is how much people pay. So on average, people are paying for a family plan $6,000 a month. Some people are paying much more. I pay $6,000 a year. Sorry, thank you. There are some people though who actually do pay almost that much a month. And then we pay. I think my family pays something like $9,000, a little over $9,000 a year. And my employer pays something like $13,000 a year. And the problem with this, the increase of premiums has slowed. It was really bad before. It definitely is slow. The ACA has helped it slow. Like from, till 2012, from 2006 to 2012, it went up 37%. From 2012 to 2018, it only rose 25%. The problem is that wages aren't keeping up with it, right? So like my premium's gone up from like $6,000 a year to $9,000 a year. I haven't gotten a $3,000 raise in that time. My salary's gone up something like, I don't know what it is, like $1,700, right? So over time, I'm shorted more and more and more. You add up these trend lines, and pretty soon we're going to be out a lot of money. Median income in Michigan is $55,000, right? So when you're talking about the total costs, that really cuts in. That means half of people in Michigan make less than $55,000 a year. 2/3 of all the bankruptcies in this country are due to medical bills, and it's probably higher than that. Okay, because another chunk, about 15% of the bankruptcies are recorded in government statistics as due to credit card default payments. But a lot of people are maxing out their credit cards to pay their medical bills. Or they paid their medical bills in cash, so now they got nothing to pay their grocery bills, their gas bill, and everything like that, and that's what they're maxing out their credit cards on. So that's about 1 million Americans a year. 25% of Americans struggle to pay their medical bills, including 20% of the people who have insurance. So it's people without and with insurance. And again, the key is that this is an unknown phenomenon in other countries. Every country has a slightly different system. There are many different models to choose from. There's the Australian model, the German model, the British model, and so on. But in none of these models do people file for bankruptcy because they broke their foot ice skating and went to the ER and it turned out it wasn't covered by insurance. This doesn't happen anywhere. One of the worst and most heartbreaking statistics is that 42%, okay, almost half of everyone who's diagnosed with cancer in this country, within 2 years, they will be penniless. They will be completely broke. That's a lot of people with insurance, because the insurance will fight them on every new treatment that their doctors are doing for them. The chemo, the radiation chemo will be covered, but the radiation won't be covered. And you're talking about hundreds of thousands of dollars. People sell their homes, they sell their businesses, they liquidate their kids' college funds, right? GoFundMe. Single largest category is medical debt. The CEO of GoFundMe has recently come out and said when he started this website, it was never intended to be an alternative health insurance system. It was intended for, someone's house burned down or whatever. They rescued a cat or something like that, right? And you can go on GoFundMe and you can see all these different people. This guy, Shane, it's backlit, so it's hard to see his face. It's a young man named Shane Boyle from Arizona who he was diabetic and had to resort to GoFundMe to pay his monthly insulin bill, which was $750. And at first he was able to do it, but then the donations kind of dried up as people got tired of donating to him every single month. And he died. He died of diabetes. This happens frequently. So this is where we start to get into the more controversial stuff. And you may have questions about this, and you may want to push back, but this is our position, is that health insurance companies are a big part of the problem. Not the only part, but a big part of the problem. And the reason is that they deny coverage. And they do it as a matter of formula. In other words, they have a quota oftentimes of what they'll deny. They'll say every fifth claim, just deny it. Don't give a reason. So there's an average 20% denial rate from insurance companies. There are some companies, like United Health, which are said to have a 50 or 60% denial rate. Now, why do they deny so much, right? They expect that some people will fight them. They expect that some doctors or hospitals will threaten them with legal action to get their payment. They'll expect that some patients will sit on the phone for hours and hours and hours bombarding them with demands and letters. And then they usually give in. If you have the experience of going to the hospital, thinking your insurance covered it, coming home a month later, you get a bill for $10 or $20 or $30,000 in the mail, what you should do is call the hospital and say, I'm not paying this. And they'll say, okay, well, perhaps we could negotiate it down to, $8,000. And then you say, I'm not paying that either. And you just don't pay, and they eventually go away. But the thing is, a lot of people don't know that. And they know that a lot of people don't know that. And they know that a lot of that a lot of doctors and hospitals are just overworked and they'll just eat the costs. So it's a way to boost their bottom lines. And these have real impacts on people, right? She says that after she had a small stroke, she needed rehab, but Aetna wouldn't cover the rehab because it thought that she didn't need it. These aren't doctors making these decisions. These are bean counters at the insurance company. So she had to go into $30,000 in debt. And here's a guy responding to her on Twitter. This is just from earlier this year saying, yeah, same thing happened to me. Here's a bill. Pay, cash, check, or charge, $107,000 and $99.64. And then there's this particularly insidious form of what's called surprise billing, where, in this case, these are a whole series done by a journalist named Sarah Cliff at the website Vox.com of people that this happens to. It's estimated that this happens to, I think the number is 45, it could be 46% of everyone who visits the ER gets a surprise bill. In other words, you have insurance. You broke your leg, you're in a lot of pain. It's the last thing on your mind, but you do pull your insurance card out and you give it to the lady while they take you in and they fix you up. And then a month later, you get a bill for everything that they did anyway, $12,000, $20,000, $30,000, right? Which most Americans can't pay. Routinely, these stories of people their toddler bumped his head and seemed to be kind of dizzy. They weren't sure maybe it was a concussion. Call the after-hours nurse, pediatric nurse, said, take him to the ER, get him checked out. They get him checked out, they do the concussion test, everything, and it's fine. He's okay, he's responsive, pupils look fine. Here's the children's Tylenol and a little ice pack for his head, and everything will be fine. A month later, a bill comes in the mail for $20,000 for children's Tylenol and an ice pack, and 20 minutes with an attending to make sure they didn't have a concussion. And it gets worse than that, because there are a lot of people who know what it means for their families to run up the debt. There are a lot of people who will say, look, I've got cancer, I've got Parkinson's, I'm probably going to die. And on the way out, I'm going to rack up a lot of bills. And my insurance is probably not going to pay for those bills, right? So I'm going to die and leave my family crushed financially. We're now seeing a new trend of people killing themselves so that they don't have to drag their families down with them. And by the way, this happens to Republicans as much as it happens to Democrats. Talk to a guy, very right-wing guy, big Trump supporter, big Patrick Colbeck supporter, running for Congress, for state Congress in Livingston County, in Howell, who told me he's against everything else, he hates immigrants, blah, 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 but he'd be for single-payer health care. Because his dad owned a small business his whole life, worked very hard, and his business went under the recession when he was 63 and a half years old. And rather than go on, the exchanges and buy, he just decided, listen, I got 18 months to go before I get on Medicare. I'll be fine. What could happen? And he had a massive heart attack. And they took him in, they opened him up, 17 hours of open heart surgery, and he didn't make it. And so then, his dad died, his mother was a widow, and then his mother got a bill for $280,000, right? After their whole life's work, their business had gone under. So, when this happens to people, they become advocates of single payer very quickly. And again, people can push back on this, but our feeling is, and it may sound radical because it's something most of us have lived with all our lives, health insurance, especially health insurance through employers, is something that's not even 3 generations old in this country. It's only something that came about after World War II. It didn't used to exist. It was a historical accident. I can go into the details of it later, but it doesn't, and this is going to sound crazy to people, but it doesn't make sense as a business model. Auto insurance makes sense. Homeowners insurance makes sense. For insurance to work, you have to have a pool of people paying in, knowing that only some of those people are going to need to pay out. If everybody pays in and everybody needs to pay out, why have the pool, right? If we had the health insurance model for auto insurance, it would be like saying everybody or 95% of people who own a car are probably going to get in a crash this year. Or 95% of the people who own a home is going to get burned down or flooded or blown away by a tornado this year. That's not the case. So the only way that health insurance companies can make money, can make profits, is by denying care, by denying coverage. They're also, because they're based on profits, they spend a lot more on administration, or we call overhead. And by that I mean everything from CEO pay to building, glitzy new headquarters, like in downtown Detroit, or marketing. Every time you see some new billboard at Comerica Park sponsored by Blue Cross Blue Shield, or you watch a football game on TV and it's something nice sponsored by Aetna, right? That's your premium dollars. You're paying those, and they're using them on sponsoring billboards rather than on paying for people's surgeries. Medicare, you notice, doesn't employ sales teams, it doesn't employ marketers, it doesn't take out huge ads or sponsor baseball stadiums. So it only spends 2% of the money it takes in on things that aren't healthcare. And you can see how much this adds up to. The CEO of Aetna makes almost $60 million a year, the CEO of United Health makes $83 million, and the CEO of Blue Cross Blue Shield Michigan, Dan Lepp, makes $19 million a year. And he just got a $16 million raise from 3 years ago. Some people have pushed back and said, look, doctors are part of the problem too, hospitals are part of the problem too. And sometimes we're told that we're a little bit too pro-doctor and anti-insurance company, and that might be a fair criticism. But it's important to point out that the average doctor spends $80,000 a year dealing with all the paperwork involved in insurance. And a lot of that's just getting those rejections, those pro forma rejections from the insurance companies, calling them up saying, why is this rejected? They give some, excuse my language, bullshit reason, and then they, fight them and say, well, we're demanding legal action or whatever, and they do this back and forth for months, and then they finally get, negotiate, they'll get 70% of what they're owed, right? But they're out all the time that takes, all the staff they have to pay to get them to do that. right? That's a third of all their income. We talked to a lot of doctors, you guys, who said they got into medicine to help people, not to become experts in the insurance industry, which is what they spend close to 40% of their time doing. These are just pictures of what the people who are really at the bottom of the food chain, what's the 30 million people who don't have health insurance, what it looks like in places like Appalachia here, where people line up for a once-a-year free traveling road show where they set up in horse stalls and abandoned stores, mobile dentistry. It's their only chance to get an abscessed tooth out or a cavity filled or get eyeglasses or get a lump in their breast taken a look at. So that's kind of the scope of the problem. What about the solution? Okay, so we're talking about Medicare for All. First thing we should say is the proper thing to call it is improved and expanded Medicare for All. One of the most common misconceptions, and it's completely understandable, is that people, especially people who are on Medicare, will say, well, now hold on, now I have to pay, I still got to pay out of pocket, and it doesn't cover dental, and it doesn't cover vision, and it's not as great as all you young people think it is. The bills that are proposed, the ones that are getting argued about constantly in these debates, right? The one in the U.S. House of Representatives introduced by Pramila Jayapal and Debbie Dingell, I should say, from Michigan, 1384, and then in the Senate by Bernie Sanders, 1804. And then there's also a similar bill, but it's kind of stalled right now. It hasn't been reintroduced yet by the representative from Ann Arbor, Yusuf Rabhi, at the state level. All of these offer improved and expanded Medicare for All. So this is how it would work if it were to pass. Everybody would be automatically enrolled. You wouldn't have to fill out a form or apply for anything. You would get a card and instructions in the mail, and that would be that. There would be no, and this is also a common misconception, when people say, well, it's not free. We're not saying it's free, but it's free at the point of service, meaning no copays, no premiums, no deductibles. As we'll see, financing it's not free. But it means that when you go to the doctor, getting seen is not contingent upon whether you've got $25 in your purse or your checking account or not. Or you're not hesitant to take your kid in because their fever is spiking and you got $45 left in your checking account, your utility bill is due. If you pay for the copay, you're going to get your lights shut off. That's a situation a lot of Americans are in, right? What makes it expanded and improved is that it includes what Medicare includes, but it also includes vision. It also includes dental, and it also includes hearing aids, and it also includes podiatry, which Medicare also doesn't include right now. It also includes, and this is new, long-term elder and disability care, including in-home care, right? So all of that would be covered. And transportation, which Medicaid does cover. So there are a lot of people who may have Medicaid or Medicare, but they live especially in rural areas or in urban inner city areas where they can't use it because they can't get to the doctor. One of the things that it does is it controls costs. And this is where we get into the hospital side. And this is where, again, some of the controversy and you may have questions about or pushback on. We spend way too much in this country on healthcare. Part of that is there are some doctors who make too much money. They make way more than their counterparts make in Britain or Germany. Even though, before I met my wife, I dated a woman in Germany whose father was a doctor, and their house was plenty big in the suburbs of Berlin. They were not poor. He had a driver, he had a Mercedes, and one of the nice Mercedes, I forget what class it is. It's just that he didn't have a yacht in his own island. And that's not fair. Most healthcare professionals don't. They're not, I'm not trying to, it's just that there are some that jack up rates. But there needs to be a way to bring down the amount that the hospitals are spending, like a parent giving a teenager an allowance, right? They'll say to a hospital, Medicare would say to a local hospital, it would say, based on your last 3 years of revenues and expenses, and based on the averages that we're looking at and a bunch of other inputs, here's how much we're going to give you to spend. And in other words, how much we're going to reimburse you for. We'll call it $200 million a year. You overshoot that $200 million, the rest is on you. So you have an incentive to not spend all your money on new waterfalls or new atriums or marketing. And again, the hospital that, so my kid was born, fast forward, we were there for another year. He got pretty sick with scarlet fever, which I didn't even know you could get anymore. And his pediatrician told him, go to the ER. Went to the hospital in Berlin, and it was a very nondescript building, just like a flat office park type building. You just walk in, there's just a desk. They tell you to go to this room. You walk in, it's just a plain old room. In the room, there's a table. Next to the table, there's a doctor. The doctor gave him medicine. He got better. We did move back to the States, actually to Wisconsin, before I ended up here in Madison, and we had another kid born, and this is this beautiful hospital with there was a waterfall and a big atrium with plants, and there was a grand piano, the guy playing Chopin because it makes you calmer and all this kind of stuff, but that's what all the money is going to. You don't need all of that when your kid has scarlet fever, for crying out loud. You need a doctor who will give you the right medicine. Also, this gives the government the ability to negotiate with pharmaceutical companies and to negotiate with an edge. And the edge is, if they don't play ball on drug prices, they'll take your patent away. The government giveth patents, the government can taketh patents away, right? If you're going to use taxpayers' money to get a patent and then charge people $750 a month for insulin, you can lose that patent. So, and then also very important, the Jayapal bill envisions a 2-year transition. Some people think this is way too short. 2 years, we'll get there in 2 years. The Sanders proposal is 4 years. Some people even think that's too short. Some people think it's too long. The Jayapal offers 2 years of salary replacement for displaced workers. The Sanders 5 years. And you can use that money, so in other words, if you work in an insurance company, the insurance company is probably going to go out of business. You will get the equivalent of your salary, either just as a benefits payment, or you can apply that to re-educating yourself, going back to school, getting retrained, and frankly, a lot of people are going to be needed to be hired by Medicaid. And so that's where we get to probably the number one question most people have: how are you going to pay for it, right? This is always what people want to know. How are you going to pay for it? So before I get to that, I'm going to back up a little bit. Just look at the big picture of the money. Right now we spend, probably it's actually a little bit higher than $3 trillion on healthcare in this country. That's all together, right? So that's all the money that the government spends on Medicaid, VA, Medicare, and all the money that we spend on our premiums and our deductibles and our copays. The funny thing about this, as much as people say some people say they're against single payer, is about 60% of the money that we spend as a country is already single payer. 1.88 trillion a year goes through Medicaid, Medicare, VA, CHIP, TRICARE, just for military families, Indian healthcare. So what we're spending out of pocket through private companies is about 1.12 trillion. I realize these are humongous numbers. They're hard to imagine. The question is, how are we going to find that other 1.12 trillion? Or they often like to do this over 10 years, so I'll say 11 trillion over 10 years. But the key thing to remember is that finding that 11 trillion over 10 years is not new sources of money. We are already spending it. I'm going to put this in really big red letters because this is the number one fact that gets missed by a lot of people, by a lot of journalists, by a lot of politicians. And I've met with a lot of politicians. I've met with your guys' congresswoman. I've met with a lot of people. And this is something that's really hard to wrap your mind around. This is not new spending. We are rerouting the spending. Right now, I pay, it's something like, again, like $9,000 a year in premiums to Blue Cross Blue Shield. Imagine their Blue Cross Blue Shield's up here. That money comes out of my pocket, the Blue Cross Blue Shield, and then some of it goes down to the various doctors and pediatricians and everybody. We're talking about taking that $9,000 and sending it to the government, and then it comes back to the doctors and pediatricians and so on. It's not like the $9,000 is coming out of my pocket to Blue Cross Blue Shield, and here comes another $9,000 out of my pocket to the government on top of the $9,000. If you watch the congressional hearings that have been held so far in this, most Republicans and some Democrats don't realize this. It's not new spending. So you are trading deductibles, you are trading premiums, you are trading co-pays for taxes, right? So there hasn't been a single set plan for paying for it. What has been done is like a menu of options, a menu of choices that you could mix and match with to pay for it. 4.5% household premium of all households above $29,000 in income, okay? That would raise $3.5 trillion over 10 years. That gets you a little over a quarter of the way. This would save the average family around $4,000 a year in out-of-pocket costs. Because, again, we're spending, for my family, I gained this out, we're more in the upper end of the income spectrum, spending $9,000, not having to spend that $9,000, and then probably paying, we'd be looking at about $6,000 more in taxes. We still come out $3,000 ahead. It's still saving us $3,000 a year. And although we're kind of more on the upper end, we're not in the 99th percentile. Like we still have a basement to finish. That $3,000 over the next few years accumulated, that's our basement, you guys. That's a lot of money. It's really the upper, 2 or 3% in income that probably wouldn't see that much savings. Employers would pay a 7.5% income tax after their first $2 million in earnings. So small businesses under $2 million in revenue wouldn't pay anything. They'd come out the most ahead. This would raise $4 trillion over 10 years. This will save employers $9,000 a year. I've talked to, some of you may have different experiences, but I've talked to a lot of small business or medium business-sized business owners who are paying upwards of 28% of their payroll on employee health care benefits. You drop from 27 down to 7.5, you are saving a lot of money. Now, some people will argue, and we can get into this in Q&A, how's that money going to come back to workers and wages? That's a good question, we'll get to that. There's still other options for raising money for this, though, that have been proposed. First of all, the employers get a tax loophole for the benefits when they offer. They can write that off their taxes. You do this, you close that tax break, that nets the government $4 trillion over 10 years. A wealth tax, a very popular proposal many candidates have proposed. On wealth over 21 million, that nets the government $1.3 trillion over 10 years. There's other proposals too, but this is more than enough to pay for it, right? This is more than enough to pay for it. Remember, every other country in the world does some form of this. We're the only ones who don't, and we're also the richest country in the history of the planet. Bolivia and Nepal this past year just became the newest additions to the Universal Healthcare Club. Bolivia, Nepal. So when people say, well, we can't afford to do it, tell them, are we really that much poorer than Nepal? Actually, the answer is we can't afford not to have Medicare for All, or some version of it. Because if we do nothing, remember I said $3 trillion about, maybe a little bit higher, some people say it's 3.5, it depends exactly, but that's where we're at, 3 to 3.5. If we do nothing in 10 years, it's going to be $6 trillion a year we're spending. Premiums will be so high that very few employers will be able to afford them. So again, the United States will save, over the course of 10 years, if we were to adopt this year, which we won't obviously, but if we were, we would save anywhere from $2 to $5 trillion as a country. In part simply because of the inefficiency and the waste of having this middleman of the health insurance companies, in part because health insurance companies don't control the costs, the overcharging of the hospitals. The $2 trillion, by the way, comes from a very right-wing libertarian think tank called the Mercatus Institute that did a whole big study hoping to disprove Medicare for All and ended up inadvertently admitting that it would save the country $2 trillion. The $5 trillion is more left-wing think tank from the University of Massachusetts. You could split the difference and call it $3.5 trillion. You could still fix every road and bridge in this country for that much money. You could send everybody to college for 40 years for that much money. right? And then one of the objections, a lot of times, especially when people who are more like in the club of, supporting Democrats will say, okay, great, I'm on board, but how's it going to get passed? Like, how are we going to pass this? Obviously, we have to take the White House, which we will, right? We have to take the Senate, which we will. And then you still have a problem because you got to get to 60 votes in the Senate, and there's no way we're going to get 60 votes. And even if we did, there's some very conservative Democrats will be difficult. One way of doing is simply ending the filibuster. All right. Elizabeth Warren has said that she would do it. Other candidates have different positions. Bernie Sanders has said that he would use a parliamentary loophole. It's called reconciliation. And I won't get into the weeds of it, but if you have questions about it, it's kind of a devious plan, a diabolical plan, I should say. And it has some, I'm not sure if it's entirely constitutional, but it is a plan. It is a plan. You'd be surprised what is actually constitutional and not constitutional. Anyway, so a lot of candidates have actually co-sponsored this. And obviously Sanders wrote it, Gillibrand helped to write it, Warren has co-sponsored it. Harris, who has just recently come out with their own plan, also co-sponsored it, so did Cory Booker. The polling is all over the map, I'll be honest with you. We can talk about this too. And this is the best polling that you'll see. 85% of Democrats in favor, 70% of Republicans, 52%, or 70% of independents, 52% of Republicans, 70% overall. You compare that to where Obamacare was in 2009, it was at 37%. So let's just go over what would be the pros of this particular approach, and we're coming to the end. As I explained in my experience in Germany, everybody would be in network, right? 45% of people who go to the ER come away with an unexpected bill because that hospital or that ER might be in your network. The attending might be in your network. But the anesthesiologist who comes to see you because you had surgery on your leg, it's an emergency, is not in your network. There's nothing you can do about that when they're rushing you into surgery because you broke your leg in a car accident or a skiing accident. You can't stop and say, no, I want a comparison shop. You're just thinking, put me out, man, and fix me up. Okay, and as soon as you wake up and the anesthesiologist, you ever looked at your explanation of benefits and you had surgery, you'll see an anesthesiologist give you tens of thousands of dollars for giving you a little bit of a drip. I just knock people over the head. Right, you don't have to worry about that. You go out of state, doesn't matter. Right, you go to a different town, you have to go to the hospital, doesn't matter. Same system everywhere, same card, just have your card with you. And this, for me too, I'm in a union. Every 3 years, when it's time to negotiate our contract, management says, I'd love to give you guys a raise, but healthcare costs are just killing us. We could pass the costs on to you and give you a raise, or we could keep the premiums down but no raise. And inevitably our union negotiating team says, we'll forego the raise. You could just keep those healthcare costs down, in part because we have an older workforce where I work, and they don't want to have those premium increases. They always use that to make us choose between wages and premiums. We know that a lot of people are stuck in jobs they don't want to be in because they can't risk starting their own business. They can't risk, going back to school. They can't risk doing something else because they gotta work for a company that gives them the benefits. At age 65, entrepreneurship spikes in this country, 15%, because people are on Medicare and they're able to do it. We don't have good numbers on this. We only have anecdotal stuff. But a lot of people say that one of the reasons that abused women don't leave abusive husbands is because they, or more importantly, their children, the husband has the benefits through his job. They can't leave, or they won't be able to go to the doctor, so it's worth taking the abuse. Auto insurance, guys, is also about 60% of auto insurance is actually health insurance, right? Because if you get in an accident, they use the auto insurance to pay for, you if you're hurt or somebody else that you might have crashed into. So we could be seeing, although the recent law may change this a little bit, lower it, up to a 60% reduction in your auto insurance. Homeowners insurance, anything with general liability, right? Because there's not going to be a need, if somebody slips on your sidewalk because you didn't shovel soon enough or whatever, you didn't put enough salt down, They don't need to sue you to cover their medical bills. They sue you to cover their medical bills because their insurance company won't cover them because they'll tell them, oh, you broke your kneecap on your neighbor's sidewalk? Sue them. We're not covering it. You sue them to get it covered. That's how we make money. We go tell the trial lawyers to sue them. So that gets rid of a lot of the expenses of workers' comp, malpractice insurance, the so-called ambulance chasing, right? Tuition has been skyrocketing. One of the number one reasons why is because all those administrators and professors, their health insurance costs are so high. And so, that gets passed on. Finance charges, those million bankruptcies a year, that's what partially drives up the credit card rates. And even prices, it's estimated that, I think it's $1,400 or $1,500 of the sticker price of every car made in America is the health insurance costs that GM has to pay for its employees. The reason that you go look at a Ford Fusion and then you go look at a Kia Optima, and I did this a few years ago, I test drove them both, I thought they were both pretty nice cars, about the same, liked them equally. The Optima's $1,500 cheaper because Korea has single-payer health insurance. So Kia doesn't have to pay for its employees' health insurance. Again, letting doctors focus on medicine again. And to me, this is, again, a lot of people will say, well, no, I get great insurance through my employer. I don't want to mess with it. And that's understandable. But I don't know if you guys have seen the headlines today. Washington Post, New York Times. The stock market just plunged 800 points. It's the biggest loss in many years. All signs point to a recession. I hope it doesn't happen, because we saw what happened with the last one and it was not good. But people are going to get laid off if there's a recession, and then they lose their health insurance. And to me, that's barbaric. If you lose your job, that's bad enough. It shouldn't mean your life is in danger. So I just want to end by talking about some of the other proposals, because I know that's been brought up a lot. There's a lot of debate about policy in the debates and in talk shows. Debbie Stabenow, our senator, has introduced a bill called a Medicare buy-in at 50. And I've talked to her about this, and she's actually on board with Medicare For All. She just doesn't think that it can pass. She's proposing something that can pass. So at 50, you'd be able to switch off your employer insurance or Obamacare insurance and get onto Medicare. And so the pros, obviously, is that because people from 50 to 65, statistically speaking, use up the most health care, that would lower the overall cost, it would lower premiums for the rest of us. The cons are, what about all the people under 50? It's really the millennials and the Gen Zers, if you've got kids or even grandkids that are graduating from college, those jobs with the cushy jobs with GM that have the great benefits, they don't exist anymore. And frankly, if there's going to be another recession, even more of those jobs are going to get wiped out for the upcoming generation. Joe Biden has proposed a plan, Medicare buy-in public option. So we'd have Obamacare, but one of the plans that you could buy on Obamacare would be Medicare. You could buy in, and it would be available to everyone, as opposed to the Debbie Stabenow thing, which would only be for people above 50. And it would definitely compete with the private insurance to lower prices, right? The problem with this is that having a buy-in is difficult. About half of Americans, as you saw, can't afford to buy anything. And then we also have the problem of a two-tiered system, where some people have the private insurance and other people will have the public option. And many doctors will say, I'm only taking the private patients because they pay more. It's also the case that the number 2 biggest lobby in America is the health insurance lobby. And they will do everything they can to undermine that and try to get more business-friendly regulations. There's another very interesting plan introduced by Representative Jan Schakowsky, who's from where I grew up in the North Shore of Chicago, called Medicare for America. This is what Beto O'Rourke and Pete Buttigieg back. And so this is very close to Medicare for All. The pros are, so it's different in that, as we'll talk about, the Medicare For All single payer plan, it bans duplicative health insurance, right? Meaning private health insurance can exist, but it can't compete with what Medicare offers. So just for example, Medicare, let's say that it would offer 6 chiropractic visits a year. About 4.5 years ago, I threw my back out. It was just, I was nothing. It was just changing a light bulb. And the next morning I woke up, I couldn't get out of bed. And I went to a chiropractor and said, your back is really messed up. What'd you do? I said, I was changing a light bulb. I said, how many people does it take to change a light bulb? No. And he said, you need to come here every month, maybe even twice a month for the foreseeable future. My BCS plan covered 12 visits a year. If it were 6 visits a year, I'd have to have an extra plan, knowing that I have a bad back. Now, he fixed me good. I've been good for about 4 years. But I know my back. My dad had it too. It could go. And then I'll probably need those 12 visits. So maybe I'm on Medicare For All. Maybe I buy a supplemental plan that adds some more chiropractic visits in, right? But it can't compete with Medicare. This plan allows there to be private health insurance alongside of the public, the Medicare. It allows you to leave for Medicare. Like you can, if you have a job, you can say, I don't want the company plan, I want to be on Medicare. It caps the premiums at $5,000 a year, and that's the most expensive. It goes down by income, so it's very affordable. It caps deductibles at $350 a year. So once you pay $350 out of pocket, no matter how rich you are, you're done paying out of pocket, right? That's all pretty good. And all newborns will automatically be enrolled, and as the years roll on, more and more and more of the country will be in it, so it's more of a gradual stepping into Medicare for All. It's a very, very good, interesting plan. My objection is that it still creates a 2-tiered system. My experience in Germany, again, was that we could go anywhere we wanted. That wouldn't be the case with this. You'd still need to check and see if the hospital you're going to took your Medicare or not. So I just want to end by showing the healthcare activist Addie Barkin, who's dying of Lou Gehrig's disease. He probably doesn't have much longer to go. He testified in front of Congress earlier this year, only able to speak through a computer. And he said, any proposal that maintains financial barriers to care, any proposal that continues to charge patients exorbitant copays, deductibles, and premiums will necessarily leave people out. Any proposal that maintains the for-profit health insurance will require that some people don't get the health care that they need. So, just to sum up, our health insurance system is far too expensive and inefficient. Our out-of-pocket prices are skyrocketing. They're crushing middle-class families. Medicare for All would save most Americans money, would save the country money. Private health insurance is a big part of the problem, and it should be phased out. And Medicare for All is politically popular, and it can be passed despite the filibuster if the Democratic Party really coalesces around it. So I'm going to end with that, and happy to take your questions. So I hope you have a lot.
I actually have 2 questions. The first is, you frequently hear complaints that, for example, Canada, people are having to go to the veterinarian's office to get a CAT scan, that their national health care program is not all that it's cracked up to be. So I guess, how do we, are those complaints valid? Do they really have, what are the issues that they have in countries that have national health care? And then my other concern is, and it's a concern in favor of this, but it's a concern is the United States government and its responsibility with money is not good. So what protections are there that they don't rob the Medicare for All fund to fund something else? You know where I'm going with this?
Yeah, those are really, really valid concerns. The issue in Canada, there's two things about that. So there are times where if your needs are not deemed essential, you have to wait. The thing is, in this country, especially in the less affluent areas, you have to wait anyway. I mean, how many of us have had the experience of being told, like, I don't like the look of this test, I don't like the look of this scan, I want you to make an appointment with a neurologist, I want you to make an appointment with a cardiologist, I want you to make an appointment with a psychiatrist, and then you're told, okay, we can get you in December. You know, you don't have anything early, then, well, unless something opens up, you know, we'll call you, but, you know, our earliest time is December, you know, it's August, and you need a psychiatrist. Like that, you know, we have those waiting, we ration care, we have those waiting lines now. In many countries, you know, Canada has its own particular system, and we don't necessarily have to take over the Canadian system. In Germany, in Australia, in Korea, in Israel, there aren't waiting lines. And the thing to remember is that their national health insurance programs in these countries like Britain, Germany, Australia are so popular that even the conservative parties in those countries defend them. You know, the guy who just became Prime Minister of Great Britain, who had been the very right-wing mayor of London at one point, named Boris Johnson, this really flamboyant, outlandish character. You know, one of the first things he said is, you know, we will not let, you know, he's a big Brexit guy, doesn't want the EU in Britain. I don't want the EU in Britain, I don't want them messing with our national health program, you know. That's how you win elections in Britain, is standing up for the national health program. The guy who brought single-payer health care to Canada is a guy named Tommy Douglas in Saskatchewan. And at first it was very unpopular and he lost his election, but then he was reelected as Prime Minister, and now he goes down as he's like the George Washington of Canada. He's the most popular figure in Canadian history. I would say that as far as, you know, money being, there's two issues. One is money going to be mismanaged, just like poorly allocated, and the second is, are corrupt or, you know, nefarious politicians, maybe Republicans, going to get in there at some point and start raiding it, like they've been raiding the school fund in the state of Michigan. And I would say that's a possibility. You know, we have to be prepared for that. But remember that 60% of the money we spend in this country is already single payer. It's already Medicare and Medicaid. So they could already do that. That's $1.88 trillion they could take a chunk of. And you just have to deal with it. You have to defend it. You have to be on guard. It has to be an issue in every election. What I would love to see in this country is us pass this, and it's not perfect, or there's some fraud or some waste or something like that, and that becomes the election theme. Let us hear how you're going to prevent, you know, anybody stealing from our Medicare For All. Let us hear what you're going to add to it. It doesn't cover, you know, stuff for people with flat feet or whatever. Let's run on that platform.
Like a lot of things, proper oversight.
I mean, that's what you guys are for. I mean, that's literally what Indivisible is for. That's what was missing before 2016 that you guys are here for. And I can tell you all the politicians I've talked to have been like, okay, we need, like, people are watching us now. They used to never, nobody, the guy from Ypsilanti told me, the representative from there told me, like, before 2016, I was lonely in Lansing. I just sit in my office all day. Nobody come to visit me. Nobody protested me. Nobody thanked me. Nobody paid any attention to me. Could have done anything I wanted to. Now these Indivisible groups are constantly coming at me. Yeah.
What happens if you're going to make private health insurance gone? What happens with all the people that are employed through those? Because there's a lot of people that live that way. That's gonna.
There's 2 million people in this country. Mm-hmm. Yeah, and most of them would lose their jobs. And you know that's tough. There's two things to say about that, though. Again, both plans provide direct benefits for those people. You're displaced, you get 2 or 5 years of salary replacement. You can apply that to going back to school. You can apply that for job retraining. Medicare is going to expand. It's going to need a lot of the same people with the same skills, the same knowledge of the same networks, the same knowledge of the same billing software, all that stuff. So some of them are going to be rehired. Some of them can opt for early retirement. And honestly, I got to tell you guys, you may push back on me on this, but the government picks winners and losers all the time. Amazon.com got picked as a winner because it doesn't pay taxes, because the government decided that an internet company doesn't have to pay taxes. When this legislation starts to move forward, hopefully when we, after 2021, when we take back power in Washington completely, we need to hear your voices. All of those things need to be made loud and clear, right? And you guys know how to do that. You know how to meet with Haley Stevens. You know how to meet with Debbie Stabenow. I've met with Pramila Jayapal and brought up not that issue, but some other related issues that weren't in the bill. But did you guys know these bills go through multiple iterations, multiple versions, and they add stuff and they go through it, and it's called the markup process, and everybody looks at it and they're, well, wait a minute, what about this? Right? And so that's super valuable. And frankly, you should just email Jayapal or Bernie Sanders and tell them that. I mean, that's literally, they're gonna, Sanders gonna be here plenty, when it comes to the primary, go to his events and tell him.
Don't they have to have life insurance or not?
Well, there are a lot of companies that did go under or went through restructuring that did cancel pensions and employee health plans, and then happened in some auto companies. So this brings up the flip side, which is that we shouldn't be tying your retirement health care benefits to your employment anymore. For a lot of us, it's too late. We worked all our lives. That was done. But for all the generations to come, or the people like me who are halfway through our careers, or not even halfway, I've been working for 15 years, I don't want to tie it anymore to my employment. Because what if this happens? What if I get retired and then they go under? I should still have everything that everybody else has and just not have to worry about paying for healthcare ever. Okay, so we're over here.
Yeah, a couple of things. Well, one, in what you just talked about, being involved, when you consider the fact that over 100 million people didn't vote in the 2016 election, we got what we deserved. But to get to this, what I'm just kind of curious about, because you travel around, what is the principal rationale by Republicans and conservatives against this concept? What is it that what are you hearing? What do they tell you why they don't like this? I mean, it's a pretty logical, rational plan, at least from my point of view. But what is it you hear from them?
Well, to be honest with you, a lot of them resort really, really quickly to the S word, socialism. Right? And as Sherry said, talk to your neighbors about this, you'll hear. It's the first thing. It's very easy to refute. Because we have Medicare, it's just expanding Medicare to everybody, right? And so if Medicare is socialism, then I guess we're already 60% a socialist country. I mean, roads are socialism, schools are socialism, the fire department's socialism. Look, some Republicans will never buy this, but others, including the guy running for state Congress, the super right-wing guy in Howell, came out and said it to me without me having to say it to him. He said, look, I'm all for the free market. I believe in the free market. But some things are needs, and the free market should be for wants. And I was like, you sound like a Marxist. I didn't say that to him. I said, I agree with you. I said, when it comes to your health, that's not the same thing as buying, your favorite brand of baked beans, right? Free market works very well when it comes to, shampoo. You go into Meijer, there's like 50 kinds of shampoo. You find exactly the right one because you have the time to sit there and read all the bottles and try them all out. When you're having chest pains, you can't try out all the different hospitals, right? It's not like going to the supermarket and buying. So that to me is the main thing. And you got to remember, they said the same thing about Medicare. They said it was socialism. Ronald Reagan recorded this record that housewives were supposed to play at parties that said that this would lead us to become the Soviet Union within a few years if we had Medicare. So yes. Okay.
One comment and one selfish question. It seems like, from your system here, that you basically solved the pre-existing condition problem. That just goes away.
Yeah.
I mean, the Republicans have claimed, we're going to keep protecting you against that, but we do away with the individual mandate, and how you expect an insurance company to, you got hurt, you want to buy a policy right now? That's a ridiculous situation, so they're crazy. The selfish question is, my wife and I are retired, we're both already on Medicare, we get additional health care benefits through her pension. We've already paid for that level of coverage. So when you want to tax our income, I think I should get a tax credit because we've already paid into the system.
Yeah, I agree with you. I mean, I really do. And again, this is the type of thing, you know, when Elizabeth Warren comes to the state stumping for votes, you got to go up to her and you got to tell her that. And you got to tell her that, because it's not just you, it's a lot of union members. You know, I'll say two things about it. It's a lot of union members, they forewent, the past tense of forego, they forewent a lot of wages, you know, at that negotiating table when their union was negotiating their contracts for them back in the 60s, back in the 70s, and so on and so forth. And they, you know, that's, you know, there should be some kind of compensation for that. But on the other hand, all the people to come who are still coming up the ladder, they shouldn't ever have to be made to choose, you know, between the having a pension through a private plan. Their working life should just be about their job and the money that they make. It shouldn't ever be, again, about their health care.
You know, I've been thinking about this for some time now, and you've obviously expanded much further than I had thought about it. It seems to me the basic problem with health insurance is it's treated like, I think you mentioned, car insurance or home insurance. Something's covered. If you have suffered a covered injury, so much is supposed to be paid. But it completely ignores all the effects of what preventive health care could bring, because you haven't suffered an injury.
So this is the global budgeting idea, right? You tell a hospital, or a health system now, it's not just the hospital, whole health system, you got $250 million to work with, $500 million to work with. It's no longer in your financial interest to like have people wait until they need open heart surgery, which brings in the most bucks, right? As opposed to just regular checkups of blood pressure and cholesterol tests, something like that. Now, if you're looking at a budget within which you can't step over, now you're going to see hospitals get all into preventive medicine very, very quickly. They're going to have treadmills in every home. And you're right. You're absolutely right.
Have you seen the Ford Hospital West Bloomfield facility?
No.
They claim it's the most beautiful hospital in the world, and it is gorgeous.
I'm sure it
But you
is.
look at it and say, where did this money come from?
Hi there. Thank you.
We have time for two more questions.
Okay,
So one
well,
more, and
a
then-
couple of my questions were already kind of addressed, but I'm going to just say two quick things. One, I like when you were bringing up how other industries are being affected by these costs. I think one of the many reasons, but a very big reason why we have a teacher shortage in Michigan and truly across the country is that we're not being paid well, and it's also because of healthcare costs for those school districts. And what I'm seeing as an educator who is paying a lot of attention to what positions looked like 10 years ago and what they look like now, we have kids who are not getting the services they need in school because the school districts can't afford to hire a counselor in every school anymore. So you have one school counselor for 5 elementary schools. Or there's a lot of people that have jobs in schools now that they're only being offered to work part-time because the school district can't afford to give that professional educator with a master's degree health insurance. And so they give them less than 35 hours or whatever it is by law. So it's really impacting lots of other industries. And the other thing I wanted to say, the comment that I hear all the time, and you brought it up, was people who say, you want to be able to keep your insurance. Well, the insurance companies are the ones deciding what that insurance looks like. I've been using the marketplace since it started 4 years ago, I think, 5 years ago. And I've loved it because I can really explore and decide, but every single year, the plans have changed. And they change not just the premium, but what the plan looks like. This is Blue Cross Blue Shield, and they're changing the rules every single year. So when someone says, well, I want to keep my insurance, we have to realize that the insurance companies are determining what that looks like. And that's impacting people a lot.
So just real quick, and then the last question. It's not just school districts, it's also municipalities. Ypsilanti ran into a real crisis a couple of years ago when premiums skyrocketed for the city employees. They had to lay off all these essential things. They don't have enough cops. They don't have enough social workers, and crime is a problem. And that's because of the healthcare costs. And the issue of the private, it's the insurance companies, it's also your employer. People will say like, well, you can keep, so a lot of times you'll hear like Joe Biden or some of these other, they'll say like, in my plan, you can keep your insurance if you like it. Actually, most people don't decide that. Only 5% of Americans are on the Obamacare exchanges. The 150 million Americans get their employment through their insurance through their employers. Their bosses and their bosses' HR departments choose. Sometimes their unions choose their plan. It's not up to them whether they keep it or not. They can take it away at any time, and 68 million Americans every year change jobs or lose their jobs, so there's tremendous churn. People aren't just sticking with the same plan, so that's kind of a fallacy. Yes, thank you for waiting.
I'll try to be quick. I'm a dental hygienist, and I'm speaking from the dental profession. Right now, Medicare's dental plan is pitiful at best, okay? Surgeons, some, are starting to realize that the mouth is not separate, and I'm not a hairdresser of the mouth, that it is a true health thing, and that they insist that the patients have healthy mouths before they have their surgeries. Very few, but my situation, I don't like to use problem, my situation with what you're, and you've really changed my mind, so we're good. But dental health I feel like we're the redheaded stepchild of healthcare. And I know you don't have the answer, I'm just throwing this out here. I don't want dental health to be separate. Oh, it's healthcare and dental healthcare. Oh, it's healthcare and we're going to take care of your eyes. Oh, it's health, because you know what? It's all healthcare. And if I can pick and choose my doctor and my gynecologist and who does the mammogram, then I want my patients to be able to pick their dentist and their periodontist and their oral, well, everybody else.
I mean, under the Medicare For All plans by Jayapal and Sanders, that absolutely would be the case. I think you bring up a good point, though, in the framing of it, when people say, like, well, you get all these benefits and you'll get dental, as though that's, like, not part of what it should all be. But I just think that that's a response to a lot of the people who have stood up and sort of half learned about the plans and said, you think Medicare is so great, but it doesn't cover dental very well. And so the politicians are trying to say, like, oh, no, but it does now. In my plan, it really will cover all of that, and you'll be able to go to the periodontist and the dentist and all of that, the same as the pediatrician and the psychiatrist.
Yeah, that's
right.
It's just really, really quick. Sorry.
So, yeah, I was going to use my teacher voice. So very quickly, one of the things that when listening to people, and I've seen my sister do it who's been self-employed her whole life, so much time, energy, effort, researching, looking into, figuring out what plan, where the in-network, outright, what a waste of time, effort, and energy, and an increase of stress trying to look at all that stuff. And the other thing that hasn't been brought up, one of the critiques I always hear about this is that we don't have enough doctors, and there's already a doctor shortage, and you're going to have all these people who don't have medical coverage now that are going to be going to the doctor, and we don't have enough doctors for that. And what I always think immediately is like, so go ahead and they say that we don't have GPs. That's what we need, more GPs, right? Okay, so go ahead and pay for anybody who has enough education or enough smarts to get a good score on the MCAT, pay for them to go to medical school, but they have to be a GP. And if you go ahead and get a specialization, then you owe all that money back.
So this is a problem that has yet to be worked out, the kinks, but this is a matter of logistics. That yes, there's pent-up demand. Probably in the first 3 or 4 years of this, there will be a spike in people who are actually able to go to the doctor, not just the ER. And but there's a lot of ways to deal with that. When this happened in Canada, they flew people in from Europe, they flew people in from the United States, they flew them in from Japan. We could do the same thing. You fly a lot of people in, at least temporarily, from India, Europe, and so on. And you could, relax a lot of the rules that allow for more of the restrictions on how many people can go through medical school, how many can graduate. But you could also relax some of the restrictions in terms of, physicians' assistants being able to do more and see more patients, and nurse practitioners, physicians' assistants, dental hygienists, so on and so forth. So, one last thing, real quick, and then I can stay and talk to whoever wants to stay as long as you want. August 28th, so if you've been convinced by this, something that you can do is your Congresswoman Haley Stevens is still on the fence. She doesn't know, we talked to her, she's just still making up her mind. And she's having a town hall about healthcare on August 28th in Canton. at the, oh, and I have it on my phone, the name of the high school. Salem High School, thank you. Okay. Salem High School, and so it's at 7 o'clock, it's a Wednesday night. If you go, you know, you always get a chance to talk to her afterwards or ask questions and say, listen, I'm on board with this, and I think you should be too, and I want to let you know, because you guys, I mean, I don't know, maybe you do, when I talk to Democratic, people don't always realize the power that they have, the influence that they have, right? What you say, because it's not just, you could say, oh, you're just 50 voters, but your 50 voters are going to talk to 50 other people who look at all of you guys because they know you're an Indivisible, so you must know what you're talking about. So you have a lot of influence, and politicians listen to you. So if you're convinced, go talk to Haley and tell her to get on board.
Email her?
You can email her, calling is even better, meeting her in person is best.
Yes.
You can talk afterwards, I think they need to wrap up.
There is a reason why he was asked back, you know, because he has made so clear something that I really didn't quite understand, and I can see all the heads nodding out there, and it's wonderful. Now we can spread the word. Now we know how to have those conversations with our neighbors when they bring out those certain talking points that seem to happen all the time. So we really, because what you've done is empowered us, and that's important. So we will take this power and we will talk to Representative Stevens about this, and we will continue to do what we're doing right now, and that's really, really moving towards making things better than they are. And thanks so much for coming back again. Yes, one.
Quick commercial break.
Okay.
Should you need one of these beautiful t-shirts for the Labor Day parade, or just to wear at your leisure, I would be glad to sell you one. $15 a piece.
Okay.
So please come and see me. I have a few more left.
That was the end of our commercial and the end of our meeting. Thank you very much. See you in a month. Or no,